Part 3. Recommendations for Sexual Consent and Sexual Violence Prevention. Consent communication can be one of many important aspects of sexual violence prevention. This chapter concludes with recommendations toward research and practice, specifically strategies to address sexual violence prevention in the context of sexual consent communication with emphasis on young men. Recommendation 1. More consent research. First, we need to continue researching sexual consent as a construct to better understand the nuances associated with consent communication, including how individual differences, consent characteristics, and sociocultural factors influence consent communication, particularly gender and gender norms. Additionally, research aimed at assessing the associations among attitude and belief antecedents of sexual violence, consent communication, and sexual assault perpetration and victimization is warranted. Better understanding sexual consent in the context of sexual violence will also contribute to existing educational programs. Given that sexual consent is a burgeoning area of research, and sexual violence prevention programs have only just started to make consent a key feature of their programming, there is still plenty to investigate. For example, alcohol-facilitated sexual assault is common among young adults and college students in particular. Indeed, if sex occurs when someone is too incapacitated to consent, by definition, that is sexual assault. But what metric renders someone too incapacitated to consent to sex? It seems unrealistic for prevention initiatives to promote complete abstinence from sex when small amounts of alcohol have been consumed, particularly given that consensual drunk sex occurs among college students. Doing so may result in people disregarding initiatives for being out of touch. People certainly experience cognitive impairment even at low levels of intoxication. However, being slightly cognitively impaired is not the same as being cognitively impaired to the extent that one is not capable of consenting. After all, alcohol administration studies allow people to consent to participate in research while intoxicated. As such, it is important, albeit ethically challenging, for researchers to ask how drunk is too drunk to consent to sex, and especially for men who typically serve as sexual initiators, how drunk is too drunk to be able to accurately discern a person's consent cues. Research aimed at examining the extent that alcohol intoxication influences people's cognitive ability to communicate and accurately interpret consent is paramount. Further, examining constructs like hypermasculinity and precarious manhood as they relate to alcohol intoxication's influence on consent, communication, and interpretation may also be particularly helpful in better understanding the interplay among these sexual assault risk factors. Additionally, the flip side of consent communication is refusal communication. Research suggests that men hear and understand sexual refusals, even those that are subtle and do not include the word no. Despite men demonstrating knowledge and understanding of subtle refusals, some men claim ignorance or insufficient knowledge as a justification for why they are not responsible for sexual assault. This dynamic warrants continued investigation, particularly with larger sample sizes. The depth of the qualitative studies this information is based on helps us understand the potential problematic nuances of the miscommunication model, but larger-scale studies will be fruitful in helping researchers better understand the scope of this problem. Similarly, important qualitative work has demonstrated the complexity of consent communication in relation to gender norms and sexual double standards. Continued efforts to examine how such issues influence consent communication, particularly men's communication and interpretation of consent and refusal cues, are warranted. Consistent with recommendations from Degu and colleagues 2014, it is also important for researchers to investigate the effects of sexual consult education and promotion initiatives on victimization and perpetration behaviors. SHARP, consent promotion posters, and Define Your Line all demonstrate positive outcomes associated with consent, increased awareness and knowledge, positive attitudes toward consent, and increased behavioral control to ask for consent. However, changes in victimization and perpetration as a result of these initiatives have not been assessed. Silver and Havlick's 2018 findings suggest that people who endorse rape myth acceptance may not be influenced by these kinds of campaigns because they do not see sexual violence as salient. This is concerning given that rape myth acceptance is associated with sexual assault perpetration. As such, more pointed research examining if and how these programs may influence behavioral outcomes, victimization, and perpetration is warranted. Finally, research evaluating affirmative consent policies and standards is limited. As universities continue to adopt these policies and standards, it is important to examine their effectiveness in reducing victimization and perpetration as a function of explicit consent communication. It may also be fruitful to assess if certain approaches to implementation of these policies are more or less effective in increasing explicit consent communication and reducing sexual violence. It would be unfortunate for universities to implement affirmative consent policies and standards as the primary or only sexual assault prevention tactic, but then fail to thoroughly assess the extent that they result in any behavioral change. Specifically, evaluations should assess if and how people's consent communication changes as a result of policy implementation, and if that influences victimization and perpetration rates. Recommendation 2. Consent initiatives should be more nuanced. Proponents of affirmative consent and affirmative consent initiatives portray consent as simplistic, e.g., yes means yes, consent is sexy, consent it's simple as tea. However, in reality, consent communication is quite nuanced. Sexual assault prevention initiatives that promote consent communication as being simple or sexy may be well-intentioned, and in fact, being more explicit in one's consent communication seems like it could improve aspects of sexuality such as pleasure. However, promoting consent as simplistic, without addressing the complexities surrounding the cultural norms and contextual factors that influence consent communication, does not seem to be an effective approach to sexual violence prevention. For example, such messages imply that sexual assault is a function of miscommunication, specifically women's inability to clearly communicate their refusal and men's inability to accurately understand these sometimes subtle and nonverbal cues of consent and refusal. However, such messaging fails to address men's diffusion of responsibility for sexual assault through claims of ignorance or lack of knowledge. Sexual consent promotion initiatives should address both the need to clearly and ideally affirmatively consent to sex, but also acknowledge normative ways of refusing that are largely understood by men. Additionally, current simplistic consent promotion messaging does not seem to address the gender norms that influence consent communication. Such messages imply that women are empowered to say yes and no to sex, but unfortunately, gender imbalances and inequities discussed in the earlier sections of this chapter demonstrate how women's practical ability to have their affirmative consent and refusals respected is limited, and men's expectation to live up to certain socially prescribed notions of masculinity may result in men feeling pressured to seek and have sex. This could result in men pursuing sex they do not want and pressuring women to consent or at least acquiesce for men to feel appropriately masculine. Oversimplifying this complex issue could result in initiatives being ineffective or potentially destructive. Instead, prevention efforts that highlight these socially constructed gender roles and present ways to more healthfully navigate consent communication could be beneficial. For example, via vignette-based discussions or role-playing, consent education and promotion initiatives could address these nuances in consent communication specific to gender norms, gender role socialization, and gender imbalances. Recommendation 3. Consent education and promotion should be included in a sociocultural approach to sexual violence prevention. Prevention efforts should be more comprehensive. Researchers have called for more comprehensive approaches to sexual violence prevention. Echoing these calls, sexual consent should be included in an integrated, multi-pronged, ecological approach to address sexual violence. Broader strategies to address sexual assault should include aspects of consent education and promotion, integrated with other elements shown to be effective in reducing sexual assault perpetration and victimization, such as bystander interventions, and deconstructing rape myths and other rape-supportive attitudes. For example, this chapter covered the potential influence of rape myth acceptance, endorsement of token resistance, and masculinities on sexual consent, as well as how endorsements of sexual double standards and traditional sexual scripts can contribute to victim blaming in the context of consent communication. Considering these relationships, it is important to understand factors contributing to sexual consent communication attitudes, intentions, and interpretations for college men, specifically, to more strategically design interventions and contribute to more nuanced sexual consent research. Comprehensive approaches should focus on underlying structural factors that influence consent communication, such as gender inequality and gender role socialization, and on helping young boys and men develop skills related to empathy. Such information is important given the gendered aspects of consent communication described in the earlier sections of this chapter. Rahi and colleagues, 2019, recommend that prevention programs must address the fundamental role that gender inequality plays in sexual violence, with the goal of shifting social norms surrounding noticing and respecting signs of sexual refusal. Echoing this recommendation, it is important to note that this should also apply to consent. Related, based on findings from Schaefer et al. 2018, it is also important to specifically address people's endorsements of token resistance fallacies in the context of consent education. They argue this is especially relevant as the landscape shifts from the no means no to the yes means yes imperative. Initiatives should emphasize deconstructing norms about gender and sexuality that contribute to sexual violence. Specifically, efforts should dispel rape myths, decrease hostile forms of masculinity, and challenge traditional sexually scripted gender roles, particularly as they relate to sexual consent. It is difficult to advocate for affirmative consent if there are sociocultural barriers associated with communicating consent, particularly for women. As such, it is important to address gender norms and gender roles in the context of consent communication. Start at a younger age. Although it is encouraging that universities are taking proactive steps to address sexual violence, sometimes implemented as part of a first-year orientation program, many of the norms about gender discussed in this chapter seem to be embedded in young people prior to their arrival on campus. Unfortunately, most K-12 health education curricula do not address sexual consent or comprehensive sexuality more generally. It would be beneficial for young people to be exposed to information about consent in age-appropriate ways at a younger age. There are some promising primary sexual assault prevention programs targeting middle and high school students. Systematic and comprehensive inclusion of this information in K-12 health education and implementation of comprehensive sexuality education more consistently in the United States, led by trained professionals, is highly recommended. Specifically, it is important to discuss elements of consent communication in conjunction with gender norms. Use sex-positive approaches. Despite some consent promotion approaches oversimplifying consent, consent-affirming messages should not be disregarding altogether. In fact, the collectivist notion, i.e. that consent and sex occur between people, underlying messages such as consent is sexy, is important to promote. Indeed, messages that consent is sexy, which promote affirmative sexuality and sex positivity, seem promising. They do not emphasize traditional gender roles that men initiate and women respond, which seem to perpetually underlie consent communication. However, these sex-positive approaches should be coupled with other critical intervention tactics to address the potential that affirmative consent may be perceived as unrealistic, particularly for women. If women provide an enthusiastic yes, as promoted by affirmative consent, they may face negative social repercussions. Therefore, alongside such sex-positive approaches, advocates and educators should also work to dispel damaging stereotypes about women related to slut-shaming and victim-blaming that may be endorsed by young adults in general, but sometimes especially reinforced by men as part of homosocial masculine rituals, such as seeking sex from women in social environments like bars, clubs, and parties. Additionally, as part of an affirmative approach to prevention, programs could promote the notion that being more explicit in one's consent communication is positive, erotic, and sexy. Indeed, research suggests it can contribute to better sexual encounters. Jozkowski, 2013. It is worth noting that some of these consent promotion approaches may foster healthier engagement in sexual expression, i.e. consent is sexy, but this may be distinct from reducing sexual assault. It would be helpful for programming to intentionally couple improving consensual sex and ending non-consensual sex as part of a shared goal. Recommendation 4. Continue to focus prevention efforts on boys and men. Intervention programs that target men currently exist and have shown promise in reducing perpetration, e.g., Men's Program, Men's Project. Educators and advocates should continue to focus prevention efforts on boys and men, and specifically focus efforts on challenging sexual double standards, traditionally sexually scripted gender roles, and masculine norms, as these belief systems may influence consent communication and sexual violence more broadly. For example, Druin and colleagues 2019 found that men perceived that their male friends could consent to sex despite being fairly intoxicated. Authors speculated that aspects of bystander intervention programs, specifically noticing a problematic situation, may not resonate as strongly with men, especially when intoxicated. In such situations, men's inclination may be to facilitate their intoxicated friend seeking and obtaining sex rather than to dissuade them. As such, targeted training aimed at helping men see when their male friends may be too intoxicated to consent to sex or accurately interpret a potential sex partner's consent to sex would be helpful. Additionally, role-playing and use of vignettes or testimonials could be helpful in highlighting the potential gender differences in how women and men interpret and understand consent. Specifically, such efforts could target women's and men's disjunctive interpretations of consent related to behaviors like transitioning from a social to a private setting, or men purchasing an alcoholic drink for a woman and a woman accepting. In these instances, men tend to view the behavior as more absolute in indicating consent, whereas women are more tentative, suggesting it could imply interest or consent but does not necessarily equate to consent. Activities that could better illustrate these refined distinctions in people's understanding of consent would be fruitful. Men tend to endorse rape myths and token resistance more than women, and men who endorse rape myths are more likely to have a history of sexual aggression. Further, sexually aggressive men may be uncomfortable with or resistant to acknowledging sexual violence, which allows them to continue to endorse rape myths and discount consent. And sexually aggressive men seem to perceive consensual and non-consensual sex differently than men without a history of aggression. Similarly, men seem to respond differently to sexual assault prevention initiatives based on the extent that they endorse rape-related beliefs. Taken together, sexual assault prevention educators may consider tailoring programs and employing different tactics with regard to consent education and promotion for men compared with women. Educators should also consider differentially tailoring efforts and promoting tactics for men with a history of sexual aggression or high endorsement of rape supportive beliefs compared with men without a history of aggression and lower endorsement of rape supportive beliefs. It is also important for colleges and universities to carefully consider how they are framing consent promotion messages, including affirmative consent, to avoid deleterious effects, particularly on men. This may be especially true for men who endorse rape myth acceptance, as these men are already more prone to thinking sexual assault is not a salient issue, and writing off affirmative consent policies and campaigns. Indeed, Tinkler and colleagues 2018 found that a punitive framing of affirmative consent policies increase beliefs akin to hostile and hegemonic masculinity, which can in turn increase sexual aggression. Continued research is needed to investigate the effects of affirmative consent policy framing on sexual assault perpetration. Recommendation 5. Increase saliency of sexual violence. Finally, consistent with other recommendations, it is important that educators and advocates focus efforts toward increasing the perceived salience of sexual violence. Indeed, Silver and Havoc 2018 state that the effectiveness of such campaigns, consent promotion campaigns, may hinge on the ability to simultaneously increase the perceived salience of sexual violence in general, in order to motivate higher rape myth acceptance people to substantively engage with these sorts of messages. Thus, it is important to increase people's perceived salience at the micro and macro levels. For instance, denying sexual assault as a salient issue may encourage people's endorsement of false information, e.g., support of token resistance, perpetuating rape myth acceptance, which in turn may psychologically provide a mechanism to disregard consent promotion messages. Men have higher rape myth acceptance and lower systematic processing of consent promotion tactics than women. This suggests that the salience of sexual assault will continue to be a barrier to sexual assault prevention initiatives, especially for men, specifically those focused on consent promotion. And therefore, increasing saliency may decrease men's endorsement of rape myths and increase acceptance of consent promotion campaigns. This is why, in part, more comprehensive approaches to sexual violence prevention that include consent education and promotion are recommended. At the macro level, increased perceived saliency of sexual assault can help mobilize public support for these comprehensive, systematic interventions. Indeed, social movement campaigns such as Me Too may increase awareness of sexual violence, which can increase perceived salience. Coupling affirmative consent initiatives, policies, and media promotion campaigns with other tactics that reduce rape myths and address aspects of masculinity that perpetuate men's dominance over women may increase salience of sexual assault in general and particularly among men. Conclusion: sexual consent is complex. Individual differences, e.g. gender, context characteristics, e.g. sexual precedents, alcohol consumption, and sociocultural factors, e.g. gender norms, sexual double standards, all seem to influence our understanding of consent, including cues used to communicate consent. These factors influence and are influenced by antecedents of sexual violence, both individual attitudinal, e.g. individual endorsement of rape myths and token resistance, and sociostructural, e.g. hostile and hegemonic masculinity, traditional sexual scripts. Although institutions are taking important steps to increase awareness of sexual violence and promote consent, it is important to acknowledge the complexities of these issues. Without doing so, such initiatives may be disregarded as unrealistic or inconsistent with people's lived experiences. To do so, however, will take effort and resources. These initiatives should start prior to arrival on campus and address gender inequity and double standards. By promoting equitable, sex-positive sexual experiences via affirmative approaches to sexuality, which include affirmative, explicit consent communication, not only can we potentially reduce sexual assault victimization and perpetration, but we can also contribute toward better sexual experiences.